All right, everyone, I got my cue. I think the numbers are going slightly up to it just hit 170. So that's our cue. So good morning, good afternoon for people in Singapore where I am. Good evening. Welcome back to ESG in Design. We look forward to having you participate in our second week of events. Tomorrow, we'll have a conversation on embodied justice. And for last day, we'll have a silent auction of HKS artwork, as well as an Art for Advocacy art panel. Now I pass it on to Adam for some housekeeping.
Thanks, Angela. And of course, today is a special day because this particular session is open to the public. And so, as always, we do want to offer AIA credits for those people that are attending today. And so I will put a link in the chat with our partner CEU events, and you'll be able to click that link and then enter the code to receive your credit. You'll select the I attended button, and then you will either sign if you already have an account or register if you do not have an account. If you are an outside person of HKS, you too can receive credits. You just have to create an account. It's totally free. There's no spam, anything like that. And they will report your credits for you to the AIA or another institution that you guys are having credits for. So with that being said, if you have any questions, please send me a Teams message. We are excited to offer this for ESG and Design Week. And back to you, Angela.
Thanks, Adam. Now let's take a minute to thank our sponsors. Thanks, Adam. Now I'll begin by introducing our speakers. We do have a very impressive panel today, so just bear with me to go through this properly. We'll start the discussion with a presentation from Richard Jackson, Richard is a professor emeritus of public health at UCLA, where he was a department chair in environmental health sciences. A pediatrician, he served with the California Health Department, including as the state health officer. For 9 years, he was the director of the CDC's National Center for Environmental Health. He is an elected member of the National Academy of Medicine. Following our presentation, we will have a panel discussion with Laurie Brown, an accomplished architect, author, and professor. Laurie is a professor and director of diversity, equity, and inclusion at the School of Architecture, Syracuse University. Among her several accomplishments, she co-founded the Lead Architects XX, a women and architecture equity organization focusing on relationships between architecture and social justice issues with particular emphasis on gender and its impact upon spatial relationships. Jeff Ransom is our Chief Innovation Officer at Gale Institute. Jeff is passionate about the relationship between human experience and design and works to apply people-first design principles to communal ecosystems such as streets, public space, food systems, and energy. Working at the intersection of urban governance, business, and culture, Jeff delivers projects that are economically viable and socially equitable, as well as sustainable in terms of using energy, land, and time. And lastly, Renee Menteff, a senior design researcher here at HKS, where she integrates research efforts within the education practice area. She also serves on the board of directors for the Environmental Design Research Association and is a visiting lecturer in the College of Design at NC State University. Renee works to expand the breadth of knowledge that explore human behavior, motivation, and well-being in education settings to inform evidence-based and inclusive design practices. Please welcome our wonderful speakers. Now over to you, Richard.
Thank you for the kind introduction, and let me see if I can get this to work. Can I just check and make sure? Can you see my screen now?
Yes.
Okay. I thank you for the introduction, and my career has been mainly in health, and I'll talk more about it. But my big takeaway is we're making it very hard in our society for people to be healthy. We docs tell them what to do, but then we make it more difficult. The same is true for environment, and what we're building really shapes us. I put this picture up front because it is the triangle of the built environment, basically the senior center now being threatened with fire during the fires here in California. And on top of it all, the COVID and the pandemic. So we're looking at an iron triangle of threats. The young man on the left joined the Air Force after a couple of days after December 7th, 1941, and was eventually in the South Pacific. Half his squadron died. He survived one crash, came back after the war, married his high school sweetheart. They had 3 kids in 3 years. And in 1949, at age 27, he developed difficulty breathing and was dead within 2 days of polio, leaving my mother with 3 little babies under age 4. I think that's why I went into medicine and public health, and of course ended up in pediatrics in that process. But I was constantly confronted with the reality that we'd spend all this money in the hospital, and then people would go home to desperately impoverished conditions and bad living arrangements, and really was drawn to public health because of all of that. One of the things I learned in public health was that despite the fact that we spend 18% of the GDP on medical care, during the 20th century, we added 30 years of lifespan to Americans, but only 5 of those years came from medical care. The rest came from immunization, but better infrastructure, and to a certain extent, antibiotics was really the improvement in lifespans. I had been a young officer at CDC in the 1970s, but came back in 1994 when I became head of the National Center for Environmental Health at CDC. I was sworn in by Dr. David Satcher, who ultimately also became the Surgeon General. David's story relates to what we're talking about. He grew up in Anniston, Alabama, one of a very large family, developed whooping cough, terrible, terrible illness. You'd never want to see a child with whooping cough at age 4. He could not be hospitalized because he was a Black child, and his mother cared for him for 10 days and finally pulled him through. And I'm sure that's why he went and became an MD and a PhD, and really was a force for adding and making sure equity was built into all the health issues that we were doing. I love CDC. It was a tremendous amount of work. I had the Refugee and International Health Group there. I had emergency response, including on September 11th. And one of the things I learned in public health was society has an interest in assuring conditions where people can be healthy. And that was really our mission in the National Center for Environmental Health. And as I think about that definition of the purpose of public health, it's also the purpose of architecture, isn't it? Society has an interest to make sure we have conditions where people can be healthy. Well, I was at CDC only a few months when we got a call from Chicago that their morgues were filling up. And when the young officer went up there to investigate, it's one of the most frightening things you'll ever see is freezer trucks next to the city morgue. And 700 people had died at that point from the heat wave in Chicago. Part of it was most of them were living in thick-walled Chicago homes with black tops and no air conditioning. It got you through the winter fine, but it was brutal in the summer. And because the neighborhoods many of the folks were living in, they had nailed their windows shut. And the only relief they had was not air conditioning, but putting in a fan in a very hot room, and it turned it into a convection oven. So I don't think we really had thought about heat being a cause of death, but there are many things we do to our buildings and to our neighborhoods that make heat worse. One, we air condition the buildings and we pump the heat into the nearby neighborhoods. Two is we have removed a great deal of tree cover. And if you saw the articles about a year ago on the fact that redlining has had 3 generations of harm with lack of tree cover, high, hot neighborhoods in places that have had the least resources over the last 90 years. Heat is bad for us. Obviously, you can die from heat stroke, but it increases the production of ozone and air pollutants during that same period of time. And when you look at this picture, here's a young man doing exactly what you want him to do. He's my son, actually, running in the Atlanta Marathon. And when you're exercising like that, you're moving about 100 liters of air a minute compared to 12 liters at rest. But then the time we tell people to go exercise is often when the air quality is the worst. As you can see, around 6, 7 o'clock at night is when a lot of the football games in the South are played. So the built environments have had that effect on air quality. But early in my CDC time, the folks in chronic disease came in, and the folks from the National Center for Health Statistics, also part of CDC, and said, we're seeing an increase in body mass in Americans from the various surveys we're doing. And here was the 1995 data. And this stimulated them to really begin to look at, well, maybe diabetes is going up. As your body mass index goes up, your risk of developing diabetes goes up as well. The teal colored line is the risk for women at a threshold of 30, which is the beginning of obesity. Women have 27 times the risk of developing type 2 diabetes compared to men. So here are the diabetes rates. It's just what you would predict. As the weight went up, our diabetes levels went up. And the states that are colored red here had 12 to 15% of the adults with diabetes. Well, the chronic disease folks had written this report on physical activity and health. Americans were not being active enough. They weren't getting out and exercising, even just walking adequately. And they drafted this report for the Surgeon General and came to Dr. Satcher's office, presented it to all the center directors. And at the end of it, I was convinced that physical activity was good for you, but I said, I don't think CDC has a right to issue this report. There is not a sidewalk within miles of CDC. No one can walk around here. We don't have any physical activity support for people on the campus, and you can't bike here either. So we have no business telling people to exercise if they can't do it in a safe place. Well, of course, the report was issued, but I became obsessed with how do we change the physical environment to make it healthier for people. Unfortunately, obesity has progressed even more since that report came out. You can brand new colors, 35% of the population in those purple states now with adults with obesity. And here is the spread of diabetes in the United States. So in Louisiana, for example, 1 person in 6 has diabetes. 1 adult in 6 has diabetes. This is a disease that costs you your eyes, your kidneys, your feet, and eventually your heart. It adds about $10,000 a year to your medical care costs and shortens your lifespan by about 7 years. This is not trivial. Said I'm a pediatrician, and when I used to go to the pediatric diabetes clinic, I never saw a child with adult onset diabetes. Now we call it type 2 diabetes, and half the kids in the diabetes clinic have type 2 adult, what we used to call adult onset diabetes. And we're seeing 16-year-olds with diseases of 60-year-olds with this change in our health. As you can see, in general, the more prosperous a country is and the more it is spent on healthcare, in general, people get healthier, with one big exception. Over on the right side, you can see the country that's spending 18% of its GDP on medical care, and people live about as long as countries that are only spending about $3,000 a year on medical care. But the medical care system, in terms of climate and other things, is 10% of the US workforce. Think about the commuting that people have to take to get in there. And I'll talk about this at the end. And it's 9% of the US carbon footprint. So I've been pushing the National Academy of Medicine very hard to really demand that the medical care system stop being be much less inefficient, but also to really think about getting its carbon footprint as close to zero as possible. You all know the data, but when Armstrong walked on the moon, the CO2 level of planet Earth was 320, and today it's close to 420, 100 parts per billion increase in just 50 years. That increase in CO2 means that the climate gets hotter. And I've been accused of being political when I give these talks in parts of, including around Atlanta in the southern US. But since my kids were born, there's never been a year colder than average. Since my grandchildren were born in the last 6 years, every year has been the last 6 years have had the hottest years on record. And, there's that stair-step increase will not turn around. It's going to continue going up. The oceans have absorbed much of this heat. About 80% of the heat goes into the oceans, causing expansion of the oceans and sea level rise on top of the melting of glaciers and other such things. So, and it also acidifies the oceans, which means the base of the food chain nationally has gotten worse. If you put more heat in the atmosphere, you put more energy in the atmosphere, and storms have increased. I had the disaster program, among others, at CDC, and I went up to North Carolina after Hurricane Floyd. And there were a couple of architectural things that came home to me. One was that going into homes just 5 days after the flooding, it was unbearable. In the heat and the mold, people had to wear proper respirators to get rid of the damaged furniture and sheetrock, et cetera. And what they used to call lagoons, where the swine waste and the chicken waste was being held, and they were loaded with antibiotics too, had polluted the entire aquifer around there. I was also, in terms of architecture, was impressed that schools are so important as places of refuge. And over again, I saw school buildings being used as places that people could go to. Red Cross was doing a great job there as well. The smartest people in capitalism are desperately worried about this acceleration of weather and climate disasters. And I don't have the map from what this would have looked like 20 years ago, but it's dramatically more now than it is. The smartest people being the reinsurance industry. And they're, all of your insurance companies have a reinsurance company that's behind them. And they are raising the alarm about this. And so all of this is a recipe for depression. On the one hand, we have huge amounts of human suffering. I don't need to tell you if you watch the news. Poverty is accelerating that human suffering, and we've greatly increased the portion of the population who is struggling to get by, and the pandemic has made it worse, and planetary destruction at the same time, an iron triangle, which you as engineers would know well. So my own depression, by 1999, I felt like I've been working on parts per million and parts per billion, and things are remote to people's lives. And I read Witold Rybinski's book, The Clearing in the Distance, about one of my heroes, Frederick Law Olmsted. Olmsted, in my opinion, created many of the places in America that I love the most. He was also the head of the Sanitary Commission during the Civil War, and his work with others improved survival of wounded Union soldiers by about 50%. Olmsted learned so much about landscape architecture in his trips to England and Europe, looking at the parks there, and brought it home to us. I had been thinking more and more, and I was driving to Dr. Satcher's office for a meeting one day along Buford Highway, which is where our offices were. And I looked over to the side of the road. It's 90 degrees outside. The humidity is brutal. The air quality is lousy. And I see an elderly woman walking along carrying shopping bags in each hand. And I didn't stop and help her. I had to go to my meeting, but I thought, I was sitting in the meeting, I'm thinking, oh, that poor woman, she collapses and dies. The cause of death will be heat stroke, and it won't be bad air quality and lack of public transportation. And she's killed by a truck going by. The cause of death will be motor vehicle trauma, when the real cause of death is lack of sidewalks, lack of safe ways for her to get around, lack of public transportation. And so I went back to my offices, and I called my friend Howie Frumpkin, and I said, Howie, he was the chair of environmental health at Emory. I think how we're building America is bad for people's health, and we're focused on stuff very remote to people's lives, but where they live, where their children live, where their elderly parents live is the most important thing in people's lives. And public health knew this back in 1900. We just forgotten it. We've all gotten cars. We've removed, 1/7 of CO2 increase has been removal of forestry. So we've removed about 60,000 square miles of green space in the US. So I wrote, the very first thing I ever wrote on built environment, rather than toxic chemicals and children's health and pesticides and you name it, was this article, thought piece for Sprawl Watch about what we're doing in America is bad for people's health. And there was no literature. There had been no research from the health world into this. And it was greeted by the National Association of Home Builders, who had 24 members of Congress write to the head of CDC and say, fire that fool Jackson. He doesn't know what he's talking about. Healthier people live out in the suburbs. And I was called in, and I wasn't fired, but I said, you have to keep quiet until you have more data. So I spent a lot of time over the next couple of years with Dr. Frumpkin and Larry Frank over at Georgia Tech to write our first book about designing, planning, and building healthy communities. I had the good fortune of convincing Congress to fund our buildings there in Chamblee, which were a mess beforehand, and our labs, et cetera, and got to learn just how difficult the government process of putting things in. I wanted a physical activity facility, and they said no. I wanted covered walkways. They said no. I wanted bike racks. They said no. We eventually got them all, but it took a lot of hard work to get there. And I also wanted lobbies that were welcoming, and I wanted the elevators back and less accessible than the stairways. And I wanted people to deal with each other. I had the chance to talk to Tom Penny and a bunch of the leaders in the American Institute of Architects, and they were kind enough to put me on the board of directors as a public member of AIA, and I got to really love working with these folks, and they really embraced the health issue very strongly. I got the Academy, we got the Academy of Pediatrics to take a statement that children ought to be able to walk and bike safely to school. We had gone from 60% of kids back when I was young to only about 16% of the kids now walking and biking to school. And that's important time, physical activity time for kids. The National Academy of Medicine was confronting the obesity pandemic, and this is their first recommendation, and was communities, transportation officials, planners, health professionals need to make promoting physical activity a priority and increasing the access to places and opportunity for such activity. So in 2008, I came back to California and became the chair of environmental health there at the Fielding School of Public Health. Got to know Wendy Slusser in the bottom left corner. She was just taking over as head of the Healthy Campus Initiative, funded by some wonderful philanthropists, Jane and Terry Simmel. And one of the first things we did, the first thing a doctor will tell you if you smoke is you got to stop smoking. Well, we banned smoking on the campus. We then thought a lot more about the mental health and how do we make the healthy choice the easy choice. And that's the biggest message I want to put forward here. And this was particularly Wendy's leadership, found a bunch of less used land on the campus and put in the school gardens. The students took ownership of this. A lot of the food is being produced. You can get a lot of food out of a couple acres. And we were lucky enough to have Alice Waters, the founder of Chez Panisse, come down and retrain our food service workers. So now our students would rather eat on campus than go off campus. And think about the sustainability issue about that, because you're not in a car or going to a local pub and getting your food. I was put in charge of Be Well, built environment, and the UCLA campus was used as a cut through by the rich communities, Bel Air and Beverly Hills and Brentwood that surrounded it. You'd see more Ferraris than Fords on the campus, and people would speed through campus as they were trying to get north or south. And so we had to really think about how we got rid of the campus being a cut through. We had lousy bike routes. The picture on the right is in front of the public health school. And you can see that a Sharrow is painted on the roadway going up the hill, one lane going up and two lanes going down, totally ridiculous. And we had to change all that and green stripe it. And the bottom left, you can see something that was brought up by one of my students who was blind and trying to navigate when we stuck the kiosk with all the foods, the fast food stuff right in the way of one of the busiest places in campus. And the students really had very important input. We had to get rid of relatively easy things like gutter grates, sewer grates that would trap bicycles. We then, and this is now a 10-year-old thing that we did on the wall about what are we going to do to change the built environment of the campus. And I don't have time to go through it, but one of our ambitions was to become a bicycle-friendly campus. And the best thing that happened was Renee Fortier was then partnered with me. And where I'm going to go with this is you have the academic sort of waving his hands and saying, these are the things and here's the science, but having a management person, and Renee was in charge of transportation and events. So she had a lot of influence on campus. And so she kicked in the changes in parking, reached out to the UCLA Police Department. At this point, we've got 306 EV charging stations, and more than half of our campus gets to school in sustainable ways. And by the way, it's 80,000 people on 250 acres. So it's a big job. We've now become a very bike-friendly campus. Michael Beck and the chancellor have been very supportive of the bicycle efforts. And one of my passions is to get a safe bike route in between the two hospitals. We have a big hospital on campus, Ronald Reagan, but there is another hospital 3.5 miles away that is impossible to get back and forth to by car. And if we had a decent bike route, it would change everything. The police were very helpful, and we lowered the speed limit to 20 miles an hour on campus, and they have enforced it. And that makes a big difference. You're hit by a car going 20, you have a 5% chance of being killed. But if they're going 40, you have an 80% chance of being killed. And I want to put a shout out to the late Jeff Averill, who was FAIA, who was the campus architect. Beautiful housing. You're a graduate student, to be in buildings that look like this with easy access to campus was remarkable, bottom left. And when they rehabbed the 1950s building, opening up and daylighting the stairways and making them far more welcoming to students, and encourage people to, in fact, to burn fat instead of fossil fuels as you go up and down. Jeff also arranged to have me speak to 200 university architects back in 2014. And I laid out some of the things that we've been working out on campus, and it really has been a pleasure. And this is my next to last slide. Getting to and from UCLA is brutal. Sepulveda Pass is just stopped about 4 hours a day. We need a subway that comes down for what we call the Valley, Van Nuys, and where many people live. into the campus. In fact, one of the hardest things at my campus is recruiting faculty, because most people and employees, they can't afford living near the campus. And so putting that subway in place, and Metro wants to put they were talking about an elevated monorail. People don't like them. And I think it's a crazy idea. We need to actually put a proper subway, and we want to have a subway stop on the UCLA campus. It would be good for our students. It would be good for our workforce. It would be good for our faculty. It would be good for the environment. And it would save money. So, and it would be the busiest non-transfer stop in the entire metro. And by the way, UCLA campus will be the Olympic Village at the next Olympic Games in LA. So we need to change the iron triangle to one of sustainability, health, and income. And the other part of that triangle is a lot of the progress that was made was because of, yes, faculty to an extent, but the staff really embracing sustainability. Sustainability builds health and vice versa, and you can save money in doing that process. So with that, thank you so much for your attention. It's such a pleasure to be with you all.
Thank you so much, Richard. And it was definitely enlightening, but your passion of speaking to something that you believe in so much is contagious. So if I may, we have a few questions that we are ready to ask the panel. The first one that I have, if I would like to go ahead and jump right into it, is to our panelists. What are some of the ways the built environment affects life expectancy and food access? And how do you think we can start to address some of the issues urban environments are facing?
You want to?
Richard, maybe we just kind of go around the panel. I don't think we should have all panelists answer all questions. Maybe we just take turn.
Why don't you call us out, Angela, please? Who
I
you
will, definitely. Well, Richard, would you like to go first? While Laurie and Renee and Jeff are turning on the camera. The ways the built environment affects life expectancy, which you already on a little bit.
As you know, life expectancy has dropped 2 years just in the last couple of years. Part of that is COVID, and part of it is, that obesity epidemic and the diabetes epidemic, it shortens lifespan. So we've got that lack of being able to have good physical activity. And I did a PBS series, a 4-hour PBS series, and talked about cities that do a very good job of enabling people to bicycle safely. And of course, we showcased Boulder, Colorado, but then I showcased Atlanta, where that street, where nobody can get anywhere. In fact, it's a mile between the crosswalks, and it has the highest pedestrian death rate in the state because poor people got to get across the street to take the bus to work downtown. So I could go on, but let me stop there.
Laura, would you like to add on to this?
Sure. And thank you so much. It's a real pleasure to be in conversation with all of you. And thank you, Richard, for your presentation. I mean, I was thinking of it from the perspective of being primarily in the academy, and I teach design studios. And I'm very interested in ways that as an educator, I can collaborate with, we have Upstate University Medical School and hospitals. And so I've brought epidemiologists and public health scholars into my studios, and they've talked about research that they've been doing locally in Syracuse, which has one of, if not the highest rates of child poverty in the country. And what they've started to look at is how the effects of the built environment are correlating to direct health outcomes. So one of the studies that one of the scholars was doing was looking at how many boarded up buildings there are, how many dilapidated buildings there are, and then they were comparing those studies with issues of gun violence or data of gun violence. And at first, the class was like, how can you make these connections? It seems incredibly circumstantial, but she was talking about as they track these over time, that there are direct intersections between the qualities of the built environment that these communities are living in and how those intersect with rates of gun violence. So in a very direct way, when you start to think about how the built environment affects life expectancy, poorer environments lead to poorer health outcomes. And so how can we, and how can I as a design educator, help students understand that, and then to create design situations in the class to help us think through and bring in these scholars and medical professionals as a way to collaborate and think about the future. So I'm very much in the research that I've been looking at, see these correlations and how in the city of Syracuse, because that's where I'm located, there are very clear indications and expectations of what the health outcomes will be for those who live in quite impoverished neighborhoods.
I just want to supplement what Lori said, that, this one of the most prevalent disorders in America is depression, and bad environments, not being able to exercise, not being able to get contact with nature, not having contact with other people in satisfactory and healthy ways, sets you up for many disorders.
Thank you both. Renee?
Yes, just kind of tagging on to that notion of mental health and how it is related. We've talked a lot today about physical health in terms of physical activity and nutrition and access to those things. But quite a bit of the research that we're doing and that we're extremely interested in is, from a student perspective, how the built environment can really aid and support lower levels of depression or lower levels of anxiety. And we're starting to see this pattern that the more satisfied students are with their environments, they're reporting lower levels of depression and things like that. And so one way that we kind of approach this is really looking at what is the what are the typical measures that we use within environmental psychology, and how can we start to kind of navigate that relationship and understand what that looks like for these student level health outcomes that we're all concerned about.
Thank you. Renee, Jeff, would you like to share your thoughts?
I mean, I'll just add I think a lot of great stuff's already been said. I'll just add one little anecdote from Copenhagen about this, is that, so that's where I'm based, Copenhagen, Denmark. And what's interesting is my wife, she's a healthcare professional, and she interviews lots of people about their everyday behavior. And what's interesting is that in her research, she's found out that when she asks people, a question here about, well, do you exercise daily? And people will answer, no. And then she'll ask, how do you get to work? And they'll say, oh, I ride my bike. Like, oh, how far is your commute? 15 kilometers, like 10 miles. And then she's like, but you don't exercise daily. Like, no, I ride my bike to work. And so I think what's interesting, just to add that into this about, what I think is the challenge of designers and the way that we make our cities, is that people of all sort of backgrounds and ways of life, and, Richard was talking a lot about this, but if you don't, you shouldn't have to think that you're taking care of yourself, or you're taking time out, paying for a gym membership, or whatever it might be. I think we've succeeded when every city can can boast about those type of user interviews about their health and well-being, where people are getting, an hour of exercise a day on their bike and not even counting it as exercise. So
Thank you all.
Jeff, one of the things we did, sounds crazy, but we had the bike racks moved too close to the guard shack, because one of the reasons that people didn't want to bike is that bicycle theft is so common. And small thing like that really increased bicycle use.
yeah, nice. It is those little things, right? Bike theft is pretty low here in Copenhagen, because on average, every Dane has 1.5 bikes. So the key is also to saturate the market, and then no one's stealing anything.
It's just like America. We have 1.5 cars for every driver.
Thank you, guys. We're starting to receive some really good questions from our audience. Maybe we'll jump to those. Christopher Rice, thank you. The question was, this might be a tough one. Post-pandemic, we all want to return to normal, but should we? Through the lens of higher education, how can or should universities rethink how they operate, adjust the built environment, especially related to projects they want to build in the future?
I better jump on that one first, if you don't mind. I think I will never fly on an airplane again without wearing a mask. I don't care what CDC says or anybody else says. Sitting in an aluminum tube, and no matter how much they tell us they're improving the air, you probably ought to be doing it. I think, but we really do need to get back. Isolation is bad for us, and we really do need to get involved in our world much more. I worry about this coronavirus because it is essentially the common cold virus, and it's so rapidly mutating all the time. My son, and he is a doc at CDC, commented that his kids went 2 years without being sick. He was astounded. And it turned out that they weren't going to school and they were wearing masks the whole time. As soon as they went back to school, it started all over again. So I think hygiene, and I think ventilation, I'm not an expert on this, but ventilation in our schools and our buildings and other conveyances is going to be hugely important going forward. In fact, the very first discussion of ventilation came from a restaurant in China where they had set the air conditioner blowing past a person who turned out to be infected. And she infected the entire people that were in that restaurant. So we're going to have to really think deeply about this. It's actually a win-win because in some ways, smoke is such a wildfire smoke is a reality in my state and much of the West Coast now. And most people now, if they can afford it, have homes with high quality HEPA filtered things, at least in the bedrooms. And I'm talking about, frankly, upper income folks and docs and others, but I think everybody probably ought to have it. Jeff, I see your hand up.
Yeah, I'm not sure if that's the way we're supposed to do this, but we got the hand on Zoom, so I wanted to. So in the spirit of like these kind of conversations and debates, so again, a Danish story. Sorry, so I'm here. I think what's interesting is culture in this case, right? So masks, just to be a little bit controversial or like play it the other end. So kids have never had masks in Denmark. From the very beginning, they said under 12. No masks. My kids have been out of school for a total of 3 weeks through the entire pandemic. Now, there's a lot of, I don't want to go too much down this, but I think it's just interesting to think about because there's a lot of cultural elements here, right? And also built environment elements. So part of this is because schools are super well ventilated. Like there's not too many schools that don't have sort of through ventilation through it. You have light from both sides, you have light and air from both sides. You also have a situation where people follow the rules in general. So there's everyone's kind of, even though they're not wearing masks, there's like a lot of social distancing and a lot of hand washing and things. And but again, bring it back to the built environment and society is that we can still, because so many people are walking and cycling, because the city is so compact, and you could still get to and from school, to and from places, even though when people were more afraid of public transportation, which maybe isn't as well ventilated and has different issues, there was still alternatives for, especially for young kids, because it was safe to walk and bike. So they were getting to school in an easy way. They were then in schools that were sort of well-built and well ventilated. And that allowed sort of a cultural virtuous feedback loop in which we could say, hey, let's give our kids a little bit more freedom, not keep them isolated and lonely, like you were also saying. So anyway, more stories from Denmark, but just to say, it doesn't always have to be, depending on the culture and place that you're in, some rules say about COVID or whatever, don't have to be exactly the same if we get some of the built environment keys right.
I also think, so my school is in a building from the early 1900s. Our ventilation system is terrible, and they did create somewhat better ventilation, but not enough for during this time. But I think one thing that this has shown us is the flexibility and hybridity that is possible, and will be necessary moving forward. So I think, yes, part of it is we need far more robust ventilation systems. I think it also intersects with thinking about how does environmental issues intersect with passive and more systemic ways of thinking about building climates. So I think it offers actually a really interesting place to think about how, with the climate crisis, with creating spaces that are safer, more conducive for occupation within these kind of situations that will continue as we move forward. Like, this becomes a really important place for those who are designers, architects, engineers of the built environment to think about new, more hybrid ways moving forward of how we create these spaces, and flexibilities of when we have to distance or when we have to be partially online. So I think there is no return. I don't see a return to normal. I don't know what that means anymore. I think the future will be so different moving forward because it has to. We have to think about other ways of working as people contributing to the built environment, and ways as that we occupy and live in spaces moving forward too.
The only thing, I completely agree with what Lori said. The only thing that I would add to that is I think the pandemic also just further highlighted different inequities that exist, whether that be through experiences or income, et cetera. And so also realizing how quickly we flexed into this more hybrid world, and knowing how that benefits different groups of people in different ways is something that I think that we as designers will hopefully continue to bring into the way that we do our work.
I think it raises really interesting issues of our public infrastructure. And I was thinking of something Richard mentioned about schools after Katrina became these really important spaces for the community, for refuge. And I remember during the pandemic, not all people have Wi-Fi, and we have a public library very close to our house. And there would be people who would congregate in their cars during parts of the day for Wi-Fi access. And at first we're like, what the hell's going on? But then it's like, oh my gosh, this becomes a really critical point for people in our community for something that we all mostly take for granted in terms of Wi-Fi. But these public infrastructure pieces and points have to become even more robust and offering more kinds of services to support our communities in need. I think more pressure and more need is going to be placed on them moving forward.
Thank you all.
Can I just supplement one quick one? I was fortunate to chair the National Academy's Committee on Health Impact Assessment. And I will tell you that early in my career, I probably read 100 environmental impact reports, and they'd be 1,000 pages, and there'd be 3 pages on health. And when Los Angeles was trying to build the Wilshire subway, the people in Beverly Hills wanted to stop it because they didn't want the noise of the tunneling and everything else. And the health impact assessment, if you really look at the benefits, and that's one of the problems with environmental impact, we don't look at the benefits. And the subway, there are huge environmental and health benefits of having that subway. And so the impact assessment came out strongly in favor of going ahead with the subway. And it was rare, because it's very easy to say, here are the bad things that are happening if you're doing big construction, but there ought to be a net set of benefits.
That's fantastic. Thank you so much. The next question is from Laura Singh. The question is, how do we incentivize healthy built environments and urban planning in low-income communities that don't have the same funding as college campuses or richer neighborhoods, especially with the additional impact on gentrification? Any hands?
I'm going to infuriate people. I looked up what the word gentrify meant, and it means to refine and improve a place. So I'm not sure I'm against refining and, in fact, I'm very much in favor of refining and improving places. But we have to not allow displacement to occur in that process. And been very active around rehabbing the Los Angeles River. It was an original Olmsted plan to have it be much more natural and beautiful, and bikeways and parkland, the linear run of the 54 miles of the Los Angeles River. But it will, if you improve the quality, money goes to where things look better. And we're having that problem around the subway stops in Los Angeles as well. So you've got to think of economic incentives to make it easy for people who are there to stay where they are. But yes, the people there want better policing, better food options, and more cultural centers and green space. So, looking at the net benefits I feel very strongly about. But I'm talking too much. I'll be quiet here. Sorry.
I can jump in there and not talk about Copenhagen for once. How's that sound? So, we've done a lot of work in many, many different types of, low-income neighborhoods or informal settlements. So from Philadelphia to Houston to Buenos Aires to other places in Asia. So what I think, so two quick thoughts. One, just piggybacking on what Richard says, actually disinvestment is a way bigger problem than gentrification. So that's not that gentrification isn't a problem, especially if people are being displaced, but communities that have not had investment, that have not seen growth, that have really lost a lot of population, that's I think where the design world should be spending more time. How do we, authentically sort of revive some of those places, or do we have to make hard choices about how certain places need to be reinvented in other ways? I don't know. There's a whole tough thing about gentrification. But if we focus on low-income communities, I think our experience has a couple hallmarks, right? So the first thing is that we've been surprised how rare it is for the citizens themselves to be not only asked, but then actively, sort of empowered and engaged to be part of the solution, right? So we see, I've learned a term from some of my colleagues where they talk about extraction, right? So the design community has gotten pretty good at extracting information and talking to communities, and sometimes they talk to them like, tell me about your life, but then there's never any follow-up to that conversation. And so if we're going to, in the design world, if we're going to engage directly with the people whose lives we want to improve, say low-income communities, then we can only do that if we have the mandate or the power or the project that's also going to show them action. So if we're going to engage, we have to show action. And that, if you think about that a little bit, it's like, it's actually way easier now to just engage and hold workshops, but then we don't always make good on those workshops. And so what we're trying to do is when we work with philanthropies or cities, it's like we say from the beginning, we're not going to do an engagement process unless you have money allocated for improvement. And that money allocated for improvement cannot be already earmarked. It needs to be open-ended enough where it can be based on what we learn from the community. So that's a super tough challenge because cities have earmarked money and everything. But I think it's up to us in this design world to actually demand that of our projects. If we're going to engage, we want money, and it's got to be money that's not decided by you, but money that's informed by this engagement process. So if we just did that, we would be, I think, making huge strides in the positive direction. And then over time, the next thing we need to do is we need to make sure that there are representation in the design community, architects, engineers, urban planners, that look like the communities in which they are serving. So we need way more Black and brown architects, planners, and designers. We need way more folks that come from low incomes, whether you're white, Black, or brown, whatever. You need to have lived in poverty in a low income situation and then be in the design world. And that's a long-term challenge. But again, I think it's all of our responsibility, whether it be through internships, education, whatever. We have to reach out and make sure that the folks that are designing communities can truly empathize with the communities they're designing with and for.
Great. And I feel like we oftentimes in these conversations try to jump to what is the equitable outcome that we're searching for. And I think exactly what Jeff described is that we can never land on an equitable outcome if we don't have that equitable process that he just highlighted.
Could I just suggest, we did a lot of work around the downwinders. These are people that were downwind from the nuclear blasts and on reservations and elsewhere. And we found that you bring in all these physicists and other eggheads, they they know all the answers, right? And have no credibility with the community at all. And if you take people, what we found was we actually had to teach people, community leaders, what's an alpha particle, what's a gamma particle, what's a half-life. And you really had to invest some time into teaching them the basic vocabulary. And we ended up getting advice that was far better than we were getting from some distant expert once they had become familiar with the vocabulary of what we were doing.
The only thing I would want to add, and I'm thinking about it in the context, before we started, we were talking about in Syracuse, they're about to, well, in the near future, deconstruct the interstate system that cut the city in half. And we've gotten both a lot of state and federal funding to do this. And as the other panelists were speaking, I was thinking about the role of being politically engaged in our design discipline and working with systems such as the state and federal government, and thinking about how allocations are made, financial allocations for these projects, and how that our expertise needs to be a part of these conversations and a part of the decision-making bodies in order that we can hopefully create more equitable processes for more equitable outcomes. But I think the engagement politically on the ground is really critical to think about how we empower and work with lower income neighborhoods, because much of the damage that was done was to the lower income neighborhoods of Syracuse. So they have so much hopefully to gain once this is removed and moving forward when the new city area gets built differently. But that requires our voices and our expertise to be a part of those processes. And I think we often aren't as present in these conversations and these challenges as we need to be, across the profession more broadly.
Thank you. We have a lot of really great question pouring in. I'm just going to keep going. From Roman Harrington, what are the models examples that the speakers are excited about in which the principle of sustainability that are being touched on in this presentation are being incorporated in higher education? How are public-private entities engaging in nurturing this? Principles of sustainability.
I wasn't part of this, but I can just kind of briefly speak to a project that HKS did at UC San Diego, and it's a LEED certified neighborhood, and our architects and designers actually helped develop a course around sustainability that are then delivered to the undergraduate students that are there. So I think that was kind of an interesting model. We really try to adopt this idea of our built environments being, right, these living labs that we can continuously learn from, but it's not just the profession learning from them, but it's the students that are also kind of going through that. So that, I wasn't part of that, but I think that coming from an academic background and also having one foot in academia, that's a really interesting model that I hope that we can continue, at least, especially with the different partnerships that we have with universities.
Young people don't care about health. They're passionate about sustainability on my campus, but they only start caring about health when they're not feeling so healthy. But that partnership between the young who are arguing for sustainability and those of us who are in the clutches of the medical care system, we need to. It's back to that triangle. It's money. It's young people. It's old people. And the big problem I've had with getting the medical community to care about sustainability. By the way, the young docs all are really, medical students are passionate about climate. The old docs who are grandparents are passionate about it, but the ones in the middle say, go away, I'm doing God's work and don't bother me. And so how do we create that, again, triangle of caring? And we've put a lot of work into that.
I think it's a great question, and it's somewhat stumping me, but not entirely. And I want to highlight, and it may not be what the person who asked it was expecting, but I was thinking about sustainability in neighborhoods and in communities, that also has to think about economic sustainability. And there's a really great example in Cleveland that was done by geographers Gibson Graham that discovered how there was a need by the Cleveland Clinic that was able to empower and create alternative business models for those who were unemployed. There needed to be a laundry service. They found that there was this undiscovered opening of new business models. So they started to create and engage with Cleveland Clinic, and then they also found that they could power this through renewable sources. So it became this multi-varied endeavor that spread the wealth. It was a laundry co-op that got created. So I know the question was probably meant more about building practices as sustainability, but I think we also have to think about economic sustainability for communities where there's high rates of unemployment, where there's the need for fresh produce, where there's all of these other issues that intersect with the built environment. So when I discovered this, working with some thesis students a few years ago, I just thought it was an amazing example of how the built environment can create these other opportunities for reading economic possibilities as well.
Any add-ons? Okay, we've got another good one. Excited to ask this question. How do we build trust with communities on our intent to promote equitable solutions? Trust with communities.
I'll jump in just because it's a little bit more on what I said last time. I think, you have to show up, spend time, make good on what you're doing. and just to be clear, I think, tactical urbanism has, gotten sort of, it was trendy, and then maybe it's less so, and there's upsides and downsides to it. But I think the good thing about some tactical projects is that if you think about them not as anything final or anything that will be there forever, but you do just think about them as, trust building opportunities to show a community some action, also learn them from the way that they might interact or use, a prototypical project or a easy to implement project. And then you have to make good on that input. Again, what I said before, if you're going to put something out there, ask people for input, then we have to, do the bigger investment. So, and for me, it's like this trust thing. It's funny, we really grapple with it in the consulting world, but if you just think about trust in your own relationships, it's like if people say they're going to do stuff and then they never do it, you don't have any trust. So you got to, so it's pretty simple. Do what you say you're going to do. And if you're not able to do it, then don't go in and start promising stuff. So.
I think there's also the issue of time and duration. I know when there's partnerships with community groups, there's a lot of critique about, well, people come in and they leave. And, it's the duration of a semester or duration of a year, and that there's not the understanding that actually to build trust takes time, and it takes, and that time will span years. It's not just that it will happen overnight. And I think it's, I know as someone who wants things to happen immediately, but there's a slowness also to building trust that we also need to foster and think about when we start to do these sorts of projects, and ways that we can continually engage and give back and participate with them. So I think it's the time piece is, I think, a really important issue that we have to be far more cognizant of.
To my designers in the room too, I think I would add that we know the importance of that client relationship and the trust that it takes to kind of craft that client relationship over time. And what, my perspective on this is, how do we also extend that same sort of effort and all of that to the actual users of our buildings, and knowing the difference between that community versus who that client contact might be. And so also just recognizing the amount of trust that goes into the relationships that exist. But when we talk about gaining trust with the community, it really is about those people that are actually occupying and living in our spaces as well, and extending that a little bit further from the client into the users themselves.
I had a student do a report on stadiums and what a sucker bet they are, and how communities are sold, use your tax dollars to put in a stadium, and they're told, oh, it's going to bring in all kind of revenue, and the thing is used 10 times a year. I'd love to hear how your firm has had to deal with that in Inglewood, in the tremendous, beautiful stadium that was put in place. But is the community benefiting from it?
I can't necessarily speak to that. I'm not on that project or with that group. So Angela, if you have more of insight, but I can't really speak to that project. Sorry, Richard.
Yeah, I think we have to follow up on the question.
There's a big battle going on in Oakland right now around a new stadium, and it keeps being sold as this is going to really bring business and improve the community. Actually, baseball has a lot more games than football, so it may actually create some jobs if you got 150 games a year.
I think Leah said we do have a video to highlight community voices on the stadium. All right. This is one that's a little different from Luis. He said, how much would it be beneficial, would you think, that people move into the rural areas to live, work, instead of to another city, further away from the city?
Beneficial for who? For them and their lower cost, or beneficial for the environment, or
y'all take all of the above. How much would it be beneficial? Well, you said, would you think that people move to the rural areas? Maybe we focus on the people.
I mean, it's an interesting question where it's happening, right? I mean, Richard, you could, I think, all the people, the younger people, I'm getting older now, but I still have some cousins that are younger in LA, and they've all left. They're all moving. They're going to Asheville, North Carolina. They're going to Savannah, Georgia. They're going to, other moderately warm, they're going to upstate New York. So it's not necessarily rural areas, but I think we've got a huge problem with affordability, where people are going to rural areas. And I think it actually could be a bonus. I think for people themselves, especially their design professionals, if they're getting a little bit more in touch with how, the rural agriculture, how agriculture works, how people in rural communities, lack of transportation, car dependence, low density. Like, I think it's an interesting experience to have designers, architects, planners, whatever, living in some of those environments, a little bit more empathy for it, trying to not just make everything a city. Again, on the other hand, I think we have to, I'm much more of a proponent of, villages, smaller groupings, even in a rural environment where you're still are living relatively close together for all kinds of reasons about infrastructure investment and carbon footprint and things. So I think, the short answer, I think it's going to happen, moving to rural areas because of affordability. It would be great if we had some strategies of how to allow people to benefit from that affordability, but still live the way they want to, but in a bit more sustainable way.
The West Coast is just staggered by, if you will, homelessness, the folks being unhoused, and we are nowhere near have enough housing. 50 years ago, California was 14 million people. It's now 40 million. And housing is just unbearably expensive. And our kids are moving away, just as you said, Jeff. They can't afford to stay here. So it's a huge issue.
We have a clarification on the question. The question was, the add-on is for the health, beneficial for the health if they move to a rural area.
I don't
Good
think
question.
we can bracket out the impacts of further kind of extractive practices of what that development means. So yeah, of course, moving to rural areas would be more beneficial health-wise in some ways, maybe not in all. But I think as a profession, we also have to think about what does this mean environmentally if we just keep going and sprawling outward. I think, and I know there's major concerns given the pandemic and what does density mean in regards to public health. But I think there has to be a way to strategize and think about the environmental devastation by destroying further rural areas for development, or how does it become more nuanced and managed in a way that's not purely about sprawl, like in and around Atlanta is a terrible but good example of how that has it's been completely unruly and detrimental in so many ways. But I don't think just moving to rural areas is the answer either when we think about the future of the planet.
One of the problems the moisture content of the vegetation in the West Coast has dropped dramatically. It is far more flammable than it was even 20 years ago. And the urban interface, or the housing forest interface now, time after time, we're losing whole communities to fire. And I will tell you, by the way, that most of the people I know keep a go bag by their front door. And our fire chief has told us, and I live in Berkeley, our fire chief has told us, we are not going to fight the fires. We are in the business of rescuing people. We're not going to be able to protect property. It's just impossible with the way this is set up right now.
Thank you. I do have another follow-up. There are a couple of posts in the group chat on Inglewood Stadium. And one of the project leaders from our sport team spent a lot of time going door to door, talking to the community, which is why we were able to build trust. Their video, and I think there is another article posted in the group chat. Thank you. Thank you for allowing time for us to clarify.
Thank you.
All right. Then let's see. I think maybe we have a few other questions. We have another 15 minutes. See if we can get a couple more in. All right. What are some of the ways the built environment can motivate or exclude? ADA, equity, maybe tension on PODD, the point of decision designs. And if someone can elaborate what PODD means, that would be great too.
I'm going to just jump in quickly. I mentioned Howard Frumpkin, and he's now the research director for Trust for Public Land, and his portfolio is parks and green space in urban areas. And they've given a lot of thought to, in general, parks are built and then they're not managed adequately, and how you place the benches, where you put the exercise equipment, the sight lines so that people feel safe. One story I was told was in parks in LA, the Parks Department put in the exercise equipment, but didn't, women would not use it, partly because guys were sitting on the benches watching them and it made them uncomfortable, and they did not have sight lines to be able to watch their kids, younger kids over in the tot lot or wherever it was. And so there was a lot of wisdom in the community. They had to go really interact with the community. And by the way, I asked one of the folks, what's the most important thing in a park? And she said, the park manager. You really have to manage the place.
Okay, no hands. I'll go to the next one. Jeff, you look like you want to say something. No, okay.
Nope, I'm okay. I was just commenting on the silence. I think
All right. Next one. The factors of policy, education, and economics are important determinants of health. Can you comment on one of these areas? Policy, education, and economics. Determinants of health.
I'll just say one thing. I mean, I think that so again, back to my wife, who's a healthcare researcher, and Richard, you probably definitely know this better than me, but I think she always says, well, the best thing you could do for your health is like get an education. So at the basic level, that's really needed. But of course, education is an indicator of so many other sort of social determinants. But back to what I was also saying before, in terms of how are we mentors for, again, in the design world, how are we mentors for people from different backgrounds? How can we open up more education opportunities for people, and not only just to be designers, architects, planners, but also, education about citizenship and what's needed to be a citizen, and what's your responsibility as a citizen, but also what are you accountable for? And I think, going back again to some of that Danish propaganda, which I'd love to put out there, I think what's interesting is, again, here being American, raising some Danish kids, is that they have a sense of, their role in the world and how we're connected, and how when they do something in public space, right, if they cross a street on a red light, maybe they impact other people. And it's just amazing for me to see that education in its most basic sense can engender some of that understanding about how, we belong in a society, and our actions impact others, and the interconnectivity of it. So I would that's just some more random stories for me from Denmark, but around education. But yeah.
You triggered a quick thought, though. I education should be a civilizing process, and we have somehow decided, it's really about dumping a lot of stuff into young people's heads, rather than teaching us how to be members of a civil society. And I want to reinforce what you just said, Jeff. I want to say one other quick comment. I mentioned I did that PBS series, and I was impressed that high school kids liked it better than almost anybody, because it gave them a sense of, wow, all this stuff I'm looking at was in somebody's head at some point, and I ought to be involved in creating an environment that I want to be in. And a quick story, but so I have, for the capstones at UCLA, I required a pairing up of a health student, a public health student, with someone from another discipline, like architecture, urban planning, whatever. And a young woman and a young man decided they would do transit-oriented developments and look at the issues about TODs, because there's a lot of that stuff going on in LA with the train stops and stuff. And it was very interesting, because the woman, she was a health professional or public healther, had never really thought that everything around me was in somebody's mind, that somebody designed this. And he had never thought that women don't like walking through public settings where they can't see the sight lines. They don't feel safe there. And he undervalued the emotional and psychic security feelings that come from well-designed places. And they ended up really becoming very good friends and eventually married. So, and really public health and urban planning and architecture need to be married.
Mm-hmm. I mean, I think both of your comments really resonate, because I think as an educator, and historically architecture has remained so isolated. And I think as we move forward, we have to become more collaborative and engage these other disciplines. One, because we have something to offer. And two, that's the way we're actually going to be able to more responsively and sophisticatedly respond to the world's most pressing needs. And I think, but the institutions of higher ed are not so readily adaptable to facilitating and encouraging these kind of collaborations and collaborative teaching and research environments. But I think it's critically important. I love your example that you just gave, and thinking about, Jeff, some of your comments about, we need more designers, architects, engineers who look like the communities they are working in. We also need more educators to look like the students we teach. And we need more leaders of higher ed to look like their student bodies. So I think these changes have to happen at all levels. And there is resistance to this.
Oh,
and
yes.
I think there has to be more, solidarity and effort across all of our areas in order to make this happen, because it's going to take work to make our discipline more like the people we work with and provide services for.
I tell the folks at UCLA, a lot of my faculty are very dismissive of anybody that's collaborating and doing work outside their own stovepipe, if you will. And I literally have said to them, look, the 20th century is over. We really figured out how to do things in a deeply reductionist way in the 20th century. It doesn't work when all of our problems and challenges are now tangled together. In fact, we have a word in public health, it's called syndemic. It's a series of epidemics that are twisted together. So solving it is extremely difficult. And there's a whole science now of how you cope with syndemics.
But, you know, as an aside, that would mean review processes, tenure, those criteria all have to change if we actually want to take seriously and commit to that moving forward.
I completely
And we
agree.
shouldn't take for granted that, you know, there's some very vested interests. You know,
Yep.
change is hard. Giving up power
Yes.
is hard times two. So I don't think we should underestimate the challenge of what you guys outlined there, right? Because there's going to be different winners and losers potentially. I think we have to find out. So design a way so it's not a zero-sum game, but there's real huge giant challenges, not only about the challenge itself, but just as humans, again, giving up maybe positions, less certainty, all kinds of issues that I think we need to be aware of when also thinking about those, how we might change them.
Mm-hmm.
Renee? We good? Okay. Got another follow-up question. Might be a good last question to wrap it up. All right, rural area again. Okay, this is fun. Do you think we will see an uprise in rural living and relying more on own resources for food, etc., rather than a global economy? Seems like the pandemic and war in Ukraine is teaching us that one's independence when it comes to such main resources is becoming more and more important. Relying on own resources for food.
About 2 months ago, there were 150 immense container ships off the Long Beach and Los Angeles harbor. And folks were clamoring for these goods. And that would not have happened 30 years ago when much of our production went on in cities. In Cleveland, you just mentioned, Lori, and much of our production, we exported overseas. And as someone said, we did all that, and now you can buy 10 pairs of tube socks for $5. And I'm not sure that's progress. And, we've got to bring jobs back into these communities because, you can't survive on with just a gas station and a general store. And I love the story of Lancaster, California, where they redid their downtown for sustainability, but also restaurants, and they got rid of the state highway that went right through the center of town, routed it around. And so people love living there. This is the Top Gun town. It's very Republican, very military, but they want to be in a place that is sustainable and happy.
I guess I don't think about the individual as much as about the community or the collective. And I think it has been really interesting to watch the ideas starting to be discussed about, okay, if we start to bring back more industry and jobs at the local level, what does that mean? What kinds of things could be provided? So I guess I think about it not as an individual, which is, the kind of myth of the American and the individual is the thing, but more about the community and how the communities can start to cultivate and create more local conditions that are sustainable or beginning to be more sustainable than they currently are. So less reliant on the global and more reliant on the local. But that requires, I think, buy-in and community engagement. We can't do it by ourselves. We're not on the frontier. That's a myth. It's always been a constructed myth, but we can rely on a community of people to help and work together.
Thank you so much. I think that, Jeff, yes.
I was going to say wise words to end things. I think it's a very nice final thought, I would suggest.
Exactly. And any other last comment for the audience about how, as architects and citizens of the world, can help? Can you wrap this up? Any final comments? Yes, Richard?
You know, I realized when I was on the board of AIA that almost all the architects I met wish they were doctors, and almost all the doctors I know wish they were architects. So we probably ought to talk to each other more.
All right. Thank you. I believe that's a wrap. So it's great conversation, and thank you for joining us, everybody on the call. And for those HKSers listening, please remember to join us for tomorrow's event on embodied justice. Thank you so much. Thank you, Richard, Laurie, Renee, Jeff, for your time.
Thank you all.
Thank
Pleasure.
you. It was a
Great fun.
pleasure.
Thank you.
You
Yeah.
all.
Thank you so much.
Bye-bye.